The following is a statement by Acting Deputy Premier and Minister for Health and Social Development, Honourable Carvin Malone, on the COVID-19 update. And now the Minister.
Greetings, Virgin Islanders and friends. Consistent with government's commitment to keeping you informed, I am pleased to present our weekly updates on the territory's response to the global COVID-19 pandemic. In the interest of your safety, this week, however, is different because as a territory, we have been asked to stay at home except for persons authorized so to do. In the meantime, I want to reiterate some critical information to consider, follow, and share for your own safety and that of the entire territory. As of March 29th, you have 634,000 confirmed cases of COVID-19 globally, with 156,588 persons recovered and approximately 18,440 deaths. It is important to note that of that number, 1,063 are confirmed in the Caribbean region. These numbers are changing daily. It is important to note that all around us, these numbers are changing daily. But we must also remember that 95% of persons infected with COVID-19 remain mild, while the other 5% are in serious or critical condition. The World Health Organization continues to classify both the global and regional risk of COVID-19 as very high. On March 25th, we reported that 9 persons were under investigation, awaiting results from the Caribbean Public Health Agency, CARPHA. The Health Emergency Operations Center continues to work around the clock to contact trace and to test persons at risk. Subsequently, an additional 16 persons were tested, thus bringing the total number of persons under investigation to 25. Today, of that 25 persons, we have confirmed another positive case, one more, in the British Virgin Islands, bringing our total confirmed imported cases to 3. The third patient is a 26-year-old male with travel history to a country where there is community spread. He is currently in quarantine and had only mild symptoms. His contacts are also quarantined and are asymptomatic, which means they have no symptoms. I can now report that there are 143 persons under self-quarantine protocol at their home. Testing, containment strategies, and follow-up continue to be carried out in accordance with WHO guidance, taking into consideration the local context. The government of the Virgin Islands would like to assure the public that we continue to work in proactive manner to further detect, contain, and manage the spread of COVID-19 in our territory. We have implemented a 24-hour curfew, which is due to expire on Thursday, April 2nd. We are discussing a schedule for the public to be able to access basic critical supplies and carry out essential services. We will announce new measures to maintain, manage, and collect household waste. We are arranging with private facilities to finalize isolation centers, quarantine facilities, and accommodations for healthcare professionals, including the request for our Cuban healthcare personnel. We have arranged for transfer of patients to sister islands with speedies for Virgin Gorda and visa for other islands. The third level car park of the Dr. D. Orlando Smith Hospital has been transformed by the emergency department for enhanced pre-screening of patients subjected to COVID-19 or suspected of COVID-19. The logistical arrangements to support surge capacity is ongoing. A 25-bed field hospital equipment is being negotiated with Crown agents from the UK government. Cabinet continues to meet 6 days a week, and if required, we will meet even more frequent, 7 days. The Health Emergency Operating Center continues to work in a multi-pronged response team to leave no stone unturned as it relates to COVID-19. On Friday, March 27th, we were successful in passing the COVID-19 bill, which will allow us to introduce mandatory quarantine and fines for up to $5,000 or up to 12 months imprisonment. It will also allow us to source medical personnel and expedite their registration without delay. All of these proactive measures are being done with everyone's best interest in mind. But we must remind you that you have a role to play. We advise you to wipe the surfaces, wash your hands, use hand sanitizers, avoid touching your face, cough in your folded elbow, and if you use disposable napkin, you have to apply the one-use theory. Throw away and use another. We also advise that if you show any symptoms during this period, that you self-isolate as best as possible, even during the time of curfew with your family. We have to keep the curve of increased cases flattened, and we will accomplish this once we work together, once you do your part. Thanks to all members of the House of Assembly. I thank the government of the Virgin Islands and all those frontline persons who have been in with us day in and day out to make sure the protection of our health care in the Virgin Islands as it relates to COVID-19. I want to thank the public for complying and continuing to do so, because without your help, we will not be able to reduce the spread and flatten the curve. Ladies and gentlemen, at the end of the day, we have a duty to protect lives. And with this, I say God bless every one of us, and God bless our Virgin Islands.
The proceeding was a statement made by Acting Deputy Premier and Minister for Health and Social Development, Honourable Carvin Malone.